I'm Amy Hall. I am the administrator at the Hancock County Health Department.
And I'm Bair, and I'm the CEO of Memorial Hospital and Hancock County Senior Services. Coming into the hospital, you will see staff, a lot more staff, wearing masks. And the staff who are working on our senior campus are wearing masks. And even effective with some of the new guidance today, when we have an OB patient come in labor, that mom and significant other will be wearing masks in addition to the staff.
I do know that a lot of businesses do have their doors locked and they are doing things by appointment only. That is to help keep everyone safe. So even though the health department does have their doors locked, we are still open. We are still here for you.
There is some misunderstanding around not only this virus and how it's transmitted, but also how the illness clinic and the hospital and the health department are working together as it pertains to information and release of information. And so I guess I would encourage the community, rather than listening to the chatter and the rumor mill, if you have a question and concern and want some accurate information, we would be more than happy to answer your questions. But we do follow strictly the CDC guidelines, the IDPH guidelines, and will absolutely inform the public if we have a positive case that's here in Hancock County and what we're doing about it. But the other thing you do need to know is that we also still have very strict privacy guidelines that we must follow.
With the possibility of exposure, the Hancock County Health Department will do contact tracing. However, if you do receive a phone call from another county's health department regarding a COVID-19 positive contact, that would mean that that health department in the other county is doing what they're supposed to be doing per IDPH and CDC guidelines with doing the contact tracing. Contact tracing is basically anybody that you came into contact within a certain period of time. So with COVID-19, it's 48 hours prior to when you developed your signs and symptoms. Who did you come in contact then? And then until your diagnosis, who did you come into contact? Because after your diagnosis, you still should be quarantining yourself at home.
There's very specific guidelines that we are following around testing, and also keeping in mind that there is not a supply of the test materials that we need. So for some individuals who have the signs and symptoms, if they are able to stay home, the guidance is for them to stay at home, to self-isolate, to monitor their temperature over a 14-day period. So just because you might have the signs and symptoms, it does not mean automatically that you should be tested or will be tested.
Because the current guidelines are, if you have had contact with a known positive COVID-19 case, which that would mean laboratory confirmed, then you would quarantine yourself for the 14 days. And if you do start to develop the signs and symptoms, then you could more than likely be positive, even if you aren't tested.
Just because we don't have a positive case does not mean that there isn't someone here that is carrying the infection, because not everyone gets really sick enough to go to a provider or to come to the hospital, and they have the symptoms, they have the virus, and by staying home and taking care of the symptoms, they get over it.
I know Ada and I haven't answered every single question that everybody would have about what is the health department and the hospital doing. If you still have questions after you've seen us today, please contact either the health department or the respiratory clinic, and those numbers are on the screen below.